Vice Chair Isaacson and Representative Kenyatta and members of the Policy Committee, thank you so much for holding this hearing today. I'm Adrian Shanker, Executive Director of Bradbury-Sullivan LGBT Community Center, and I also serve as co-chair of the Health Committee on the Pennsylvania Commission on LGBTQ Affairs. Bradbury-Sullivan LGBT Community Center provides arts, health, youth, and pride programs to celebrate and support LGBTQ people throughout the Lehigh Valley. We're proud to serve people living with HIV for a variety of programs and work to prevent the transmission of HIV through health promotion, education, and HIV testing. The COVID-19 pandemic has clarified the importance of grounding public policy in sound science. And we have all seen firsthand the challenges of a communicable disease. LGBTQ people especially understand the importance of ending the HIV epidemic, which includes preventing the transmission of HIV. Biomedical research has advanced significantly in the last few decades when it comes to understanding how to best prevent HIV transmission. We know things today that were not known in the early days of the HIV epidemic. For example, we know that today if a person is undetectable, meaning that they have received treatment for HIV and a blood test does not detect HIV, that they cannot transmit the virus. We know today that people living at higher risk for contracting HIV can take a once-a-day pill called pre-exposure prophylaxis, or PrEP, which can, when taken correctly, holds incredible efficacy in preventing HIV transmission, and that includes for occupational risk as well. We know that HIV is not transmitted via saliva or urine, and certainly not by human touch. And we know something else today, which is that people living with HIV deserve to be treated with dignity and respect. For all these reasons, we're grateful that this hearing is happening today. As a matter of policy, it's critical that members of this caucus vigorously and uniformly oppose any attempts at enhanced penalties for any crime based on a person's HIV status. These enhanced penalties do not stop the spread of HIV. They just stop people from getting tested for HIV, and they cause direct harm to people living with HIV. Why do these enhanced penalties harm public health? Because if a person's aware that they're HIV positive, then they can be held liable under these statutes, even if they're undetectable and are therefore scientifically unable to transmit HIV. Even if they did not engage in any actions that could actually transmit HIV, they could still be held liable under these enhanced penalties. The Pennsylvania legislature should absolutely prioritize efforts to help end the HIV epidemic. Here are some evidence-based ways to do so. Ensure that sex education in Pennsylvania's public schools includes LGBTQ health information and information about HIV prevention, including the availability of both pre- and post-exposure prophylaxis. Ensure accessibility by requiring all publicly supported health insurance plans in Pennsylvania to provide coverage for pre- and post-exposure prophylaxis. Increase funding for HIV testing in Pennsylvania, especially in our rural communities. Criminalization statutes and enhanced penalties don't accomplish the worthy goal of preventing the spread of HIV. They don't keep anyone safe. Legislation that would further criminalize HIV in Pennsylvania has been supported by both Democrats and Republicans. We are here today speaking to the House Democratic Policy Committee to provide you with the information about this issue because unified support to oppose any and all enhanced penalties based on HIV status is necessary to ensure the rights of people living with HIV and the public health of all Pennsylvanians. Thank you.